Namaste, I am Sundar Malgi from Mysore. My problem was I was suffering from constipation and I thought it lightly, thinking that it is because of maybe age factor and other things. But actually, as the days passed, it got worsened, and since 3 months, it was getting very worst. So I have been on Ayurvedic treatment for the last since last month, and when the things really got worsened, I decided to get it investigated by the doctor. When upon investigation, it is found that I have a tumor in my intestine. Then through one of our relative, we got connected to Dr. Shushri Shetty. And then we decided finally that we will get it done by the doctor. Because of the name of the reputation of the hospital and his credentials were very good, we decided to go for the surgery. After seeing the doctor, he was very young actually. Then I had a doubt whether is the same has the same expertise as I have read it in or heard about him. But believe me, after examining, I felt very comfortable with him only because he is very humble and very simple and friendly, and as if he is speaking to the relative. So I felt very comfortable. At the end of the examination, I told him, "Sir, my life is in your care. Please take care of me." And then one word he said, "Sundar, trust me. Rest, leave it to God." That was really very encouraging. So the operation was done on 30th successfully, and came to know that the tumor was very big, and if it was allowed to go for a longer duration, it would have the things would have got worse. But God saved my life, and then I was put on a recovery process. It took about some 8 days. Believe me, every day, morning and evening, he used to come and examine me, give the right directions to the staff, and I got a very good treatment. Because of that, the recovery was so fast that I almost recovered in 4 to 5 days. It is unbelievable considering my health conditions and my age. So I want to thank Dr. Shushri Shetty, not to forget about the other staff. His deputies also were so friendly with me. I felt as if I'm in the home. I am at home because I was so comfortable. I never felt that I'm in the hospital. Apart from that, I also want to thank a dietitian who used to come daily and inquire about my health and my food requirement. And also physiotherapists, they also supported me. All in all, I got a very good treatment, and today I'm going back from this hospital as a fit and healthy, not as a patient. As rightly said, doctor treats, but God heals. It is true in this case. So thank you very much, and God bless.
Hi. Mr. Sundar Malagi came to us with complaints of progressively increasing constipation, which he had noticed in the past 1 year. For the kind of tolerant person he is, he had slowly adjusted his lifestyle by consuming low residue diet and taking over the counter laxatives. After initial evaluation and going through his report, we decided to subject him to an operation called a laparoscopic anterior resection, wherein we removed the cancerous tumor from his left side of his large intestine along with the draining lymph nodes. Through the surgery, we were happy that we could remove the entire cancerous lesion in spite of its large size and local spread. Even the post-operative biopsy was very favorable and suggestive of complete clearance of the disease. Mr. Sundar has had a quick recovery and he has almost got back to his normal routine, and we wish him a speedy recovery ahead. Colorectal cancers always produce some symptoms, except in a few patients whom it is diagnosed by a screening colonoscopy. These symptoms could be as minute as a recent onset constipation, which is associated with an intermittent diarrhea, can be associated with passing of blood in stools or black colored stools, can be associated with unintentional loss of weight, or in those who have a family history of colorectal cancers. It is important that these symptoms and signs are not taken lightly, and we always consult gastroenterologist and get a screening colonoscopy done. Thank you.